Well, good morning. I'm here with Bobbie Bagley, Director of Public Health and Community Services, to give you an update regarding the COVID-19 epidemic here in Nashua and, of course, in New Hampshire. We want to do this because we want to keep our community as safe as possible. We want to limit the spread as much as we possibly can. But we have to be straightforward about the fact that the number of cases here in Nashua, the number of cases in New Hampshire and across the country has risen significantly in November and now again in December. Now, this is what the doctors and the medical people told us from the beginning. The coronavirus is related to other viruses that we've had, although coronavirus is more serious. COVID-19, like other coronaviruses, gets worse in the wintertime because the virus seems to thrive in colder weather because people are more indoors. It's like a flu virus, but a lot more serious. So here in Nashua right now, we have 593 active cases. Now this compares to the summertime where we had 35 or 40 active cases. So you can see that those numbers are up significantly. We have our Public Health and Community Services Division has been holding testing clinics for COVID-19 every Tuesday at the Elm Street Garage. And the percentage of people in those clinics that is tested positive, which is another indicator, has gone up as well. Over the summer, it was 1 to 2%. Now it's more like 10, even 11%. So the point here is that we want you to continue to be careful. I mean, we have all made a lot of sacrifices since last March. We haven't been able to see family members as friends as much as we'd like. The city has enacted, as you probably know, a mandatory mask ordinance. When you're in a public place, encountering other people, you need to wear your mask. I was wearing it coming in, and I will wear it as I leave, but to speak to you right this moment, I'm not. But the scientists and the public health people tell us that the masks are a very effective way to limit the spread of the virus. But we want you to continue to be careful throughout this holiday season. We know that around Thanksgiving there was a jump in the number of cases just because people got together, and even in family gatherings, if someone comes in, they don't know they've got COVID-19, they don't have symptoms, and they spread it to other family members. We don't want that to happen to you or to any other Nashua family. So we're still cautioning, we're still saying you got to be cautious. Now we can see the light at the end of the tunnel. We know that the vaccines are just beginning to become available. Right now, there are vaccines arriving in various parts of the country, and we expect them here in the next week or two. So as the vaccines roll out over the next months, many people will be able to get vaccinated, and we will be able to turn the corner on the COVID-19 virus. But in the meantime, as I've already said, we need to be careful. I want to show you some slides just so you can see the numbers. And I think you're looking at a slide that says COVID-19 data metrics. The total number of cases in Nashua so far has been 2,500 approximately. As I told you, 593 active cases right now. And the hospitalization rate per 100,000, the slide said, is 2.2%, or 2.2 per 100,000. Now, that doesn't mean much. Let me translate that. We talked to the hospitals this morning, and the number of people in the hospitals, that would be Southern New Hampshire and St. Joe's together, is more than 40 people with COVID-19. Now, that number in the summertime was down 7, 8 people. Now it's between 40 and 50. But we need to make sure that that number of cases, we limit it as much as possible. We want to make sure that you and family members don't get hospitalized. Now, the hospitals are not yet at capacity. They can still handle a lot more or more, but certainly they're beginning to get stretched. And therefore, we want, again, to make sure that the virus spreads as little as we possibly can. So now I'll show you a couple of other slides, maybe a little less significant, but There's a slide, I think, that shows you that on the right that New Hampshire is in the red in terms of the escalating amounts of cases and the escalating amount of transmission. And then there is a slide, average daily case rate New England, which shows you by color code the deeper blue. The deeper blue shows more cases as to the number of cases around New England. What this shows us, of course, is that Rhode Island is actually the worst. Their hospitals are they're at capacity. Other states are better here in New England. But there are hospitals elsewhere in the country where Albuquerque and other places where they are totally at maximum capacity. So, as I said, we're not alone in terms of seeing this greater number of cases. So we've all worked together. We've been wearing our masks. We haven't seen our families. We've made these sacrifices together in order to keep each other safe. And even though certainly we have coronavirus here in Nashua, it's not nearly as bad as it would have been if we hadn't worked together to keep everyone safe. So before I introduce you to Bobbie Bagley, who's going to tell you a few more details and talk with you a little further, I just wanted to remind you to continue to wear your masks. And I would like to say, before Bobbie comes on, that she, Bobbie Bagley, and our public health nurses, our public health department, have been working tirelessly, nonstop, for the last 9 months to protect the community, often over the weekends, working with all the positive patients, working with people who've been in contact with the positive patients, all dedicated to try to make sure that as few people as possible get this serious virus. So I hope you have good holidays. I don't know if we'll talk to you again between now and then, but just continue to stay safe and be careful. Thank you very much. And I will now introduce Bobbie Bagley, who is the Director of Public Health and Community Services.
Thank you, Mayor, and good morning, Nashua. I'll start off by giving our COVID update from the global perspective, across the nation, New Hampshire as well. So globally, right now, we're looking at 68.8 million cases with 1.5 million deaths. It was reported that today is the worst day in the country with regards to the number of deaths being experienced by individuals in our country. In the United States, 15.3 million cases with 289,000 deaths is what we're counting currently. Cases in New Hampshire have reached 6,509 active cases currently, with a total of 27,592 cases. We're looking at a recovery rate that has started to go down. We were in the high 80s initially. We're at 76% recovered. That's still a good number for us, and we want to continue to see that go on. Our hospitalization rate for the state of New Hampshire is up to 3.3%, and we've had 2% deaths. It was reported out that there are increasing number of deaths in the state daily. Our COVID update counts by the week. We've seen a substantial increase in this past week from November 30th through December 6th, with over 350 cases per week in Nashua. And there is a slide that shows that, and you can see how the trending has gone. Initially, when we really thought things were bad in the beginning of this pandemic, we can see over the past 4 weeks, all throughout the month of November and the beginning of December, we continually see the numbers go up increasingly quickly. As far as our percent positive, you can see on the slide that over the last 90 days or in the past 2 days, we've seen a medium time for results coming back. But on average, we've had a number of positives of 49 out of testing of 459 with an 11.1% positivity rate. And that's including, those are both the PCR tests, which is the nasal swab, and the antigen tests as well. And we do continue to encourage testing because, again, this allows for us to see what the load or the burden of COVID-19 in our state, what it looks like, as well as what it looks like in our region and here locally in Nashua. There is also a slide here that shows the long-term care trends. And one of the things that we have been looking at is how we could maintain the safety of the residents that live in the long-term care facility as well as the staff. And you could see during the month of November how that peaked really quickly. In this first week of December, the number looks like it's leveled out just a little bit, but we're still hearing of increasing number of cases in our long-term care facility. And in fact, one of our long-term care facilities in Nashua is currently impacted very greatly with a large number of cases with their staff and with the residents. So why is that important information for us to share with you? Based on the activities that occur or have occurred over the Thanksgiving weekend with families getting together and gathering allowed for an increased exposure. That also allows for increased exposure when we go back to our workplaces, and now we're starting to see that play out in our long-term care facilities. So that brings us to talking about the community impact of COVID-19. As the mayor mentioned, our public health department, our nurses, our environmental health specialists, our staff and welfare, all of the Division of Public Health and Community Services have been repurposed in their jobs to respond to our disease investigation, our contact tracing, and even our contact monitoring. The state has prioritized populations of focus because the substantial spread has gotten to the point where our containment methods have pretty much gone out the window because the spread is rising so quickly. But we're still trying to manage the disease investigation and connecting with individuals whose tests come back positive so that we can provide education, so that we can make sure that people isolate, that they quarantine, again, because we can still slow the spread of the infection down if we can do those things. We're seeing the hard hit of COVID in our daycares, in our businesses, and our nursing homes, as you saw that previous slide, and assisted living programs, as well as with employees, our families, and in our hospitals. Our goal with these measures of pushing out information around the mask use, we know that science has shown us now that wearing of the mask does decrease the spread of the virus. We want people to be diligent and vigilant with those efforts, as well as the social distancing. The virus needs bodies, and if we can keep our distances and maintain our mask use, as well as staying at home when we're feeling ill, this will help us to decrease the impact that we're seeing in our communities. Daily, we get a statewide cluster and outbreak update. And right now in our state, we're looking at over 419 potential clusters throughout the community across the state. This includes that list that I just read off. It includes the daycares, the businesses, our nursing homes, and it includes our hospitals as well. Right now, about 7% of that list is representative of Nashua, so there's about 30 clusters that we're looking at, and that's usually like 1 to 2 positive cases, but we do know that where there's 1 or 2 cases, that can quickly grow to more if the isolation and the quarantine is not adhered to. With regards to our hospitals, our goal in maintaining and decreasing the spread is so that we don't have an impact that allows for our hospitals to not have the capacities to provide these services that they do. Hospitalizations are rising for COVID-19 in Nashua, as the mayor mentioned, and our hospitals right now are well equipped with PPE, but their staffing is starting to become more strained because once staff is exposed and have to go on quarantine and isolation, that decreases the ability for them to be at the hospitals performing other services that need to be done. So staff is being monitored. Folks will get back into the hospital as quickly as they can after isolation and after quarantine. One of the other messages that we really want to push out is that we don't want people going to the emergency room for COVID testing. Please try to get tested at the testing sites that are listed on our website as well as on the website for the Department of Health and Human Services, and make your appointments as soon as you can if you need to be tested. You can also test at our testing site on Tuesdays, and as more community testing sites open up, those will also be posted on our websites. But we do want people not to go to the emergency room because that's also taxing the capacity at the emergency rooms as well, and we don't need those extra numbers there when real emergency events need to be taken care of. When we look at exposure and close contact, we want individuals to remember your exposure is based on you being less than 6 feet from an individual for longer than 10 minutes in a cumulative amount of time. And so that's what we consider an exposure or a close contact. If you have not been in that situation, then you're not an exposure, you're not a contact, and you don't have to get tested. If you are exposed to a case, what we're asking you to do is to stay at home and avoid contact with other people. Those are people outside of your home for 10 days. Watch for signs and watch for symptoms. If you need to get tested because you have been exposed, we want you to wait at least 5 to 7 days after that exposure so that we can get an accurate testing at that time. And then make sure that you complete your 10-day of quarantine, even if your test result is negative. We were looking at an incubation period of 14 days. The CDC and our state has changed our quarantine guidelines to 10 days now, but we know the quarantine period, or incubation period, can be up to 14 days. So we want you to make sure that you complete that 10-day quarantine and then continue to watch for signs and symptoms. If you do have symptoms of COVID, we want you to stay at home. And if your symptoms are more than you can manage at home, you do need to seek medical attention as soon as possible. We are also encouraging you, if you have symptoms, again, to get tested and make sure that that's between 2 to 5 days if you're going to get rapid testing done. Please make sure that you avoid contact with people that are outside of your household, outside of that bubble that we've been talking about, so that until your symptoms have improved. And if you're fever-free for at least 24 hours, then once your isolation or quarantine period is up, then you're able to go back out to work or into the community. We are truly encouraging our community, our partners, and we do see you as partners. And we do want to thank all of our community members that have been working really hard with us to combat the spread of this viral infection. We're asking people to continue to be vigilant and maintaining their personal responsibility so that we can get to that better future that we're all looking forward to. So we're still asking, if you're sick, please stay at home. If you're having mild symptoms, please get those checked out. Get tested. Avoid large gatherings. We're actually starting to see cases emerge in even small gatherings, and those are usually with gatherings with individuals that are outside of your bubble. So that bubble is really, really important. Wear your mask all the time. Wear your mask, cover your cough, make sure that you dispose of tissues that you use appropriately, but make sure you keep that face mask on when you're out in the community. Wash your hands often and frequently. Use hand sanitizer if you cannot get to a sink with running water and soap. Make sure that you use that hand sanitizer. We're still asking people to maintain at least a minimum of 6 feet of distance from others outside of your bubble. If you can maintain greater distance, that's even better. And then also, in order to stop the spread of the infection from going to your hands, make sure that you, with the hand washing, in between that time, keep your hands away from your face. We wear our mask, and sometimes people have a habit of touching the mask. We want you to avoid that at all costs. Avoid touching your eyes, your nose, and your mouth. These are measures that we can all take to help slow and stop the spread of this infection. We're encouraging and we want people to enjoy the holiday season. We want people to do that safely, and we want people to do that smartly. We do understand that there may be people that have to travel because they haven't seen their loved ones. When you do that, you want to do that safely and you want to do that smartly as well. If you don't have to travel, please stay local. Celebrate in your home and maintain that small bubble of individuals that you're normally with. Consider having virtual celebrations. People right now have gotten so used to Zoom and seeing each other, using social media tools. Do that. If you do happen to come together in your small gatherings, please make sure you keep your mask on. And if you can, even in those spaces, social distance, and make sure that you wash your hands in those settings as well. If you do happen to travel outside of New Hampshire, Again, you want to do that smartly and you want to do that safely. The least high-risk travel is in your own personal vehicle. And when you stop at service stations, make sure you have your mask on and you wash your hands when you go in and when you come out. Traveling on shared transportation, buses, airplanes tend to be a little bit higher risk. Airplane travel happens to be a little bit safer because of the ventilation that's on the airplanes. Make sure you keep those air vents open. We tend to close those because we tend to feel cold. That is what you want to make sure you keep open because that allows for that ventilation to keep you safe. When you come back to New Hampshire, we are going to ask that you quarantine for up to 10 days upon return. And there's also policies in place or measures in place that if once you've been in quarantine for 7 days, if you get tested and you have a negative test, you can come off of quarantine after travel. We continually offer testing at our testing site over at the Elm Street Garage on Tuesdays between 3 to 5. We're still asking people to register for testing by going onto our website and signing up under our COVID testing form there. We do the nasal swab. We're also offering a rapid test for individuals who have symptoms that have been occurring for 2 to 5 days. We know that we can do this. Nashua and our greater Nashua area, and for any of those that happen to view this message today, we know that we can do this. We know that it takes us all working together. As the mayor said, we've all been making plenty of sacrifices. We need for that to continue on until we can come out of this season. We do know that vaccine is on its way. And once vaccine is here, those that can receive the vaccine, we're hoping that people will go ahead and get vaccinated. It will be in a tiered approach. We're going to make sure that those who are most at risk are vaccinated first, and that would include those who are working directly with individuals who have the greatest risk for becoming ill as a result of COVID, those in our hospitals or our healthcare setting, and our first responders. And then the vaccine will be available to those in our community. As far as what is our timeline for expectation, we're waiting for the Emergency Use Authorization Act to be passed, and once that is done, we'll be receiving vaccination here in New Hampshire in a matter of a couple of weeks. And once that occurs, then we will start our vaccine to those that are at most high risk. If you have any questions for us over at the Division of Public Health and Community Services, please give us a call on our hotline at 603-589-3456. As we're doing our testing and people are calling for results, we're going to ask you not to use the hotline for that any longer because we will call you once your results are in. So we want to make sure that we reserve the hotline for those individuals that may have questions about COVID or even about vaccination. Thank you for listening, and thank you for your continued vigilance and working with us to preserve the health of our community. Have a happy holiday if we don't talk with you between that time.